writing, and it was an English class that I was taking in college, and my teacher had us assigned to do a paper, and I was the only student out of the whole class that he read the paper, and he said, if I read your paper, that means it's good. And so I've written other papers before and have gotten compliments on them, and so I decided to write an experience that I had, and it's funny because we were just talking about medical and experiences just yesterday, and I thought this was just perfect. So I wrote my experience about my surgery on my leg, my veins. So this is what I came up with. So, I'm alive! Was my first thought upon awakening from anesthesia. I had what was called a stab venous lumpectomy surgery. In layman's terms, it meant that some of my veins were taken out of my right leg. This simple procedure required the doctors to make numerous small stabs in my leg with a tool that looks similar to a crochet hook. Once the tool is plunged into my leg, a vein is pulled out and cut off. Now, in my own mind, I envisioned the doctors in surgery with a puzzled look on their face as they're continually pulling out my veins with no end in sight, as they are whipping around ferociously like fire hoses, with blood squirting everywhere. Thank goodness I'll never really know what happened since I was in a medically induced dreamland. In the recovery room, the nurses assured me that the discharge papers would be coming soon, and once all the required signatures were on the document, I would be able to go home. I just needed to do one last thing. Pee. For most people, this small and simple task comes naturally and without any unforeseen problems, but for me, it proved to be more of a challenge. Because, you see, I was given a spinal anesthesia, which meant my whole lower body was numb. My two assigned male nurses eagerly helped me out of my bed, into my wheelchair, and down the hall to the royal yet sanitized room where I was expected to perform to my utmost abilities. Confidence overwhelmed my inner soul as I approached the toilet that I have been able to win over since the ripe old age of 3. This I could do. Since I couldn't walk by myself, these two young male nurses had to do to me what only my mom and dad have ever had to do to me, place me on the toilet. I'm sure to them this experience was second nature, but to me, I was ready to run or army crawl out the door and under the nearest hospital bed. Seeing that it was 2 against 1 and both their legs were working properly, I succumbed to their objective and was lifted out of the wheelchair. I have to admit that it was pretty intriguing to me to look down at my feet to see them lazily moving along the bathroom floor. It was like I was learning to walk all over again. As I was being entertained by my temporary handicap, a noise came from behind me, literally from behind me. To my horror, I uncontrollably farted. I couldn't believe it. Oh, this is all true, by the way. Every bit of it, seriously. I couldn't believe it. Did the nurses hear it? Was it going to smell? If it was it so bad? Oh, would it be bad enough to clear the room? With my dignity trampled to the sanitized ground, I had no choice but to put the flatulence experience behind me. It was comforting to know that in just a few short hours, this whole thing would be but a distant memory. Not. The nurses left me sitting on my not-so-golden throne and instructed me to pull the emergency cord when I'm done. So there I sat, alone. It was just me, the John, and my hospital gown. I began to understand a whole new meaning to the word stage fright. It was silent. Desperation started to take over, and I thought to myself, nope, I was defeated. In just a few minutes, it was just a few minutes that passed before I started to feel lightheaded, and that all too familiar feeling that I was going to pass out came over me. So I did what I was instructed to do and pulled that trusty emergency cord, and that's the last thing I remember. When I came to, I was being examined by the nurses with the words cheekbone and goose egg floating from their lips. I knew that it must look pretty tragic at this point, so I thought it was quite fitting for me to begin to feel the urge to throw up. I announced my next move to my 4 nurses, and immediately they sprung into action and found the largest container possible, just a little too late. The crackers and apple juice that I consumed earlier made its way back up my throat and all down my lap. I've never been one for public display, but today I was the star of the show, for I had the privilege of passing by the entire medical staff, including the other patients. It must have been a sight to see and a hot topic to discuss around the water cooler. was given meds to bring my heart rate up, pain meds for my goose egg, headache, and teeth, not tooth, but teeth ache, and something for my stomach ache. Thank goodness the drugs put me to sleep for a few hours. Additionally, I would like to publicly apologize to the patient next to me for the occasional snorts that came out from my overly dry, wide open. That came from my overly dry, wide open mouth and the flatulence that I had absolutely no control over. It must have sounded terrible. I was no longer allowed to go into the bathroom on my own, so they placed a porta potty next to my bed. I was instructed to go in it. I had many failed attempts, but I didn't give up because I really could do this. The nurses were pumping me full of fluids to help me along, but it didn't seem to make any difference. On one particular attempt, I was sitting on the potty, wrapped in a blanket, with my right leg that had surgery propped up on the bed. Next to me was my souvenir black eye that I had made, or that made me look like an abused housewife, since that's what the lady from Fred Meyer assumed happened to me. Went in by the doctor. Not realizing the task at hand, he began talking and talking and talking. I could tell, the moment that it registered on his face, that I wasn't just sitting on the chair. He very awkwardly summarized his thought. Like Batman, he was gone in a flash. Oh, the final bathroom attempt proved to be a success. And with the sweet sound of tinkle tinkle, it was like music to my ears and a proud moment for all. The nurses cheered for me like mom would for their 2-year-old child who just learned to go potty for the first time. Minus the hug and what a big girl you are that would usually follow. As I was leaving the hospital that day, I felt like a whole new person. I had a like new leg to show off to my family and friends. A brand new shiny black eye, and a greater appreciation for what the people in the medical field have to endure for people like me. Yes, life is good, and laughter is the very best medicine.